Hi, I'm here today with BESTFOOT, Southern's Bigfoot mascot. My name is Aaron Blankenship and I'm the Peer Recovery Support Specialist here at Southern. And I'm going to be talking to him today about Narcan, a life-saving naloxone drug that reverses opioid overdose. Well, hello BESTFOOT, how are you today? All right, awesome. Have you ever seen anyone overdose from an opioid before? All right, well, let me explain it to you. So, if you were to see someone who's cold and clammy, cool to the touch, it's kind of having a little bit of clammy skin and a couple where they're not breathing very well and they're looking at you and they're not really coherent and they're not able to speak to you or they're not responsive, then they could be suffering from an opioid overdose. So what you would want to do is you would want to try to shake them and see if they're going to talk to you. If they don't come to and talk to you then you can lay them flat on their back and you can do what we call sternum rub, right? You can rub their sternum with your knuckles just like this to see if they'll come to and start talking to you. Okay, if they don't, then what you can do is there's a life-saving drug called Narcan that is effective for an opioid overdose. Now this drug, this Narcan, will allow them to breathe again. It will take the opioid off the brain receptors long enough for their breathing to return normally, and so then emergency medical services can come and render the aid that's needed and they take them to the hospital. So the first thing, after you feel like they're unresponsive and you think that they could possibly be an overdose victim, then you would want to take this out of the pack, this Narcan out of the pack, and this is a 4 milligram dose, of naloxone. This is spring-loaded, and if you were to hit the button, you're going to get one sprit, just like that, right? All right. So now we're ready to administer the naloxone. First, you want to call EMS. 911 will save you from any type of civil lawsuit they want to bring against you if there was any kind of complications during the administration of the naloxone. You would lay them flat on their back and you would put this up their nose and out towards their ear where you would hit the spring-loaded 4 milligram shot of naloxone into their nasal cavity. Then you would roll them over onto their side with their one arm up and their other arm over top. Their one knee over so as to their stable and they're not able to roll back over on their back. You don't want them to roll back over on their back because they could stand a chance of vomiting and aspirating on their own puke. And that would kill them. That would be bad. Okay. Then, if that doesn't work, look, listen, and feel for about 3 to 5 minutes, right? You're looking for the lungs to fill up with air. You're listening for the lungs to fill up with air. And you're really trying to pay attention to see if they're coming back into it again, right? If that doesn't work, you can roll them back over on their back and administer another shot of Narcan up the other side and repeat as necessary for as long as it takes to resuscitate them back to life or until EMS gets there. So, with all that being said, you could possibly save a life with this Narcan. If they were to come to, you have EMS on the phone and they're on their way and you want to keep a little bit of distance because they are very incoherent. They're not able to really know where they're at. And so when they come out of it, it's kind of like coming out of a real dark room into a bright light. They have no idea what's going on. After you have, or if they do not resuscitate, or if they resuscitate and they want to run off, then take note of their clothes, take note of where they're going, take note of what their name might be, or any kind of other identifying information that you have about this person. Let EMS know that when they get there so that they might be able to follow up with them because Narcan has a shelf life in your system of about 30 minutes to an hour. Opioids have a shelf life in your system for about 8 hours. All right. That means that they can overdose on the same amount of opioids that are in their system before you gave them the Narcan. They don't have to do any more. However, they may want to go ahead and use more because of the effects of the Narcan. The only side effects of this Narcan is that of acute withdrawal. It will effectively take the opioids off the brain receptors and make the brain think that it no longer has the opioids, and so therefore it will go into immediate withdrawal. These things will be like runny nose, itching, eyes watering. There could be some diarrhea. There could be some temperature going on. But these are all symptoms of what withdrawal would look like. Storage. You wouldn't want to store this in your car trunk in the summertime. Extreme heat will dissipate what the medicine's desired effect can do upon a system. The extreme cold can also do the same. You want to keep it around room temperature if possible, and it should be on your person at all times. It's not effective unless you're within arm's reach of it, right? Do you feel like you have the skills to be the one to save a life? All right, yeah.